Michelle Dworkin, you worked for many years in an executive position at USAID, and we spoke on the podcast earlier this year about what it meant to you and to the country and to the world when the Trump administration shuttered USAID. And we promised then that we would bring you back on again over the course of the next year or so to talk about some of the consequences. I think we're seeing it big time with an outbreak of a rare strain of Ebola, both in the Democratic Republic of the Congo and Uganda. I know health was not your major interest, not your major form of action, but to me, it seems like we're seeing what happens when you don't have USAID in the world. What do you think?
Oh, absolutely, 100%. USAID was a major player in prior Ebola outbreaks, not just the outbreak in West Africa in 2014, but in prior outbreaks in the Democratic Republic of the Congo between 2018 and 2020. USAID played a major role in addressing those outbreaks and supplying the protective equipment that health workers need to
Mhm.
prevent spread, strengthening the health systems to to get supplies where they need to be and coordinate vaccines and also to train health workers on proper practices and also to work with the communities themselves on very important types of behavior change elements to prevent further spread. And USAID in that situation in the Democratic Republic of the Congo, as in many other emergencies around the world, uh, would send in, and we did send in what was called a DART, a disaster assistance response team. And this happened, very early on at the first, inkling of an emergency, not after people had already, started dying and this, the spread, was unable to be contained, which is the situation that we're seeing now.
Yeah, I wanted for our listeners explain the kind of scope of the problem that we're seeing in Africa right now. WHO, the World Health Organization, which the Trump administration has also taken itself out of, has declared the outbreak a global health emergency. That's the highest level of alarm it has. Doctors Without Borders says that this is one of the fastest spreading Ebola outbreaks ever recorded. And while the numbers are always kind of suspect, especially in a situation where we don't have a lot of authorities over there, there's something well over 1,000 suspected cases, more than 220 deaths so far in the Congo, and the disease has been spreading into neighboring Uganda, which has something like 10 cases and at least one death. It's a terrible, terrible, frightening disease, and it seems to be spreading. So, can I blame Donald Trump for this, for the spreading of this outbreak? Is that fair?
Um, well, it's a complex situation, and I think there are many factors at play. I think we can definitely hold this administration accountable for terminating 80% of USAID's 770 global health projects that we had in existence in January 2025. 80% of those, with a value of $12.7 billion, are gone. Um, and the one of the big projects that is no longer in place was our major supply chain project, the Global Health Supply Chain Project, which made sure that we had stockpiles and the ability to get things like personal protective equipment, medicines, and such, and supplies where they needed to go as quickly as possible. Um, and when when this administration shuttered those projects, they also shut down many of our implementing partners, the organizations that we used to work through,
Mhm.
to actually get the work done on the ground. And when that happened, um, they lost all of the staff, not just the USAID staff, but all of the partner staff on the ground. And they lost all of that operational capacity. And that is not something you get back in a split second, in the middle of an emergency. Uh,
Right.
that
But
that capacity, and I'm also talking about, capacity of local organizations, because I know one of this administration's big complaints about USAID was, oh, we were giving too much money to, you know, either the corrupt UN or, and I say that sarcastically, or, to US organizations that were just profiting and the money was being wasted. Well, we were also working with many, many local organizations on the ground, either directly or through sub grants or subcontracts,
mhm.
um, that had the personnel there in the communities locally, and we were supporting local civil society organizations to do this. And they also lost their lifeblood of existence when foreign aid funding got cut. And so those staff are, in many cases, no longer employed, and that capacity is gone. And if you look at where this administration is, supposedly sending money now to address this crisis, there aren't a whole heck of a lot of options anymore. And so they're sending it through, guess what? The UN. Um, and guess what? A choice few US implementing partners, two of which are, unsurprisingly, given the rhetoric of this administration, um, very strongly Christian faith based organizations.
Oh boy.
Uh,
I
which is
miss,
not to say they're bad organizations. They do good work. But it is interesting the choice of organizations that they have made, to go through. And they're not, in fact, going through local organizations on the ground. Um, and so yes, I think, we can definitely blame this administration for the absolute callousness with which they terminated so many global health awards and billions of dollars of funds, without even fully understanding what they did. A former USAID, senior officer, Nicholas Enric, recently came out with a book, called Into the Wood Chipper. He was, in a senior position in the Global Health Bureau when when Doge came in and started dismantling things, and he speaks about, sitting in meetings where, these guys from Doge basically said, he gave them a briefing on what USAID was doing in global health, and they were shocked and said, oh, well, we just thought you did like abortions and stuff,
no boy.
which, by the way, we are prohibited by the Helms Amendment from doing abortions. USAID has never funded abortions. We have been prohibited by law from doing that. Um, and so the people who were flashing these programs had absolutely zero knowledge. And I think worse than that, their egos were so large that they lacked even the curiosity or the slightest hint of humility to admit that they could be wrong, or even want to learn about what we were doing so that they could make more calculated and careful decisions. Um, USAID has gone through reform processes in the past. That's fine. This was just an absolute slash and burn, and now we're seeing the effects.
Michelle, I'm struck by the fact that I don't think the cutting has ended with getting out of the World Health Organization and ending USAID. CDC has
Right.
also been cut way back, and there's this, to me, inexplicable. And I'm trying to be open-minded. I'm against Trump, but I'm trying to be open-minded. He has forbidden epidemiologists and experts in infectious disease from CDC to work with the World Health Organization, which is trying to deal with the Ebola crisis. What would be the reason for that? How does that put America first to say, no, we're not going to help with this?
Yeah,
Does it make sense?
it does not make sense. I think, the only thing that makes sense with this administration is they are focused on being transactional and driven by ego.
Right.
And so, we saw that in the case of the State Department's announcement that somehow they were going to set up some sort of a hospital for
Yes.
Americans who came down with Ebola to be sent to Kenya. And right around the same time, it's very interesting, this administration's social media has just, really gone off the rails. Um, but the State Department social media had a message that we will no longer be driven by consensus, but instead by results,
Oh,
as if the two are mutually exclusive. And, we saw how this played out in that the State Department announced, oh, we're going to set up a hospital in Kenya for Americans. And what happened? Kenya said, I don't think so. A Kenyan civil society organization said, wait a second, that doesn't sound right. Um, and so the Kenyan judicial system has now put that on hold. My guess is because we, for some reason, thought that we could just dictate what another country would do. Can you imagine if Canada said, "Oh, we're setting up a hospital for patients of X nationality in Canada. We're going to send them to a hospital we're setting up in New York instead." I mean, without clearing that with our government. I mean, it's just so ludicrous. Um, even at the most basic level in a family unit, if you try to make a decision, and just dictate it instead of on consensus, how's that go for you?
yeah.
My guess is not too
Yeah.
well.
Yeah.
Um,
Okay, so
and
I'm clearly not the only person confused by why this is happening, why we have to do this.
No, and the other thing, that I just want to point out is that this administration has been, particularly when it comes to health in Africa, has become so just blatantly corruptly transactional to the point that they said that they would be conditioning health aid to Zambia on Zambia approving for us to extract critical minerals
Ugh.
from Zambia. Now, I've seen aid being conditioned on things before when I, served as a foreign service officer. But there are two distinct differences. One is the conditions were placed by Congress in appropriations law. Um, Again, Congress being the branch of government that should be setting our budget. And secondly, the conditions that were placed on the use of aid were things like, a certain percentage of funds will be withheld until the secretary certifies to Congress that X country is respecting human rights, is investigating allegations of abuses by the military, that X country is including, let's say, indigenous persons in decision making processes, that X country is enacting legislation to address severe gender-based violence, those sorts of things. Not the president saying, we're not giving you global health money unless you cut a deal with us for your
Resources,
critical minerals, your natural resources.
right?
The other difference was, whenever those kinds of conditions were in place, there were always exceptions, for critically needed assistance that
Mhm.
were exempt, from those
Many
requirements, those
conditions.
conditions.
I have one last question, Michelle, and that's
Sure.
this. Well, if we have a policy supposedly that puts America first, does this, what you're seeing with health policy and health lack of cooperation with global agencies,
Yeah.
does that put Americans at danger? I'm thinking not just of Ebola here, but we had a hantavirus scare on a big
Exactly.
cruise ship. Are we in more danger now than we were?
I believe so. I mean, for many reasons, global health being one of them. A coworker of mine, I forget exactly the anecdote, but it went something along the lines of she was in a taxi or an Uber, back in the US and mentioned that she worked for USAID. And, the driver said something like, oh, well, how does that even benefit Americans? And she said, oh, well, do you remember that big Ebola pandemic in the US back in 2014? And the driver said, oh, gosh, no, no, I don't. And she said, exactly.
Right,
Um,
right,
Um, you know, whether we like it or not, we live in a globalized world. We live in a world where people move across borders all the time, where goods move across borders. That's how, trade works. That's how, the world works these days. And in the middle of this crisis, I also want to point out that there are somewhere around 100 ambassadorial vacancies in the world. Um, because either this administration has not nominated ambassadors or has recalled well qualified career ambassadors, has recalled them back to Washington with no explanation and has not replaced them. Two of the countries that are currently without ambassadors are the Democratic Republic of the Congo and Kenya.
oh, that's a coincidence. But
Yeah.
you know what, Michelle? We may be in danger from COVID-like epidemic viral diseases, but we can watch a UFC game right on the lawn of the White House. So
Yes,
there you
of
go. We
course.
make some exchanges here.
Yeah, and
Thank,
I also sorry if I can make, just
go ahead.
a couple other points. One of the other things that this administration just doesn't get is that the administration is responding to this with emergency humanitarian assistance. That is far from the only thing that USAID did. And indeed, I would argue that the more important thing we did was the long-term development work.
Right,
And so what you need is not just the response to the emergency, but the ongoing, consistent strengthening of health systems in these countries so that, when something like this happens, the systems are able to respond.
right.
We are seeing a greater capacity now of, for example, the Africa CDC and, certain, health workers and institutions in the Democratic Republic of the Congo, who did receive support from USAID in the past. We are seeing, some capacity that wasn't there previously to respond, but it's not enough.
Mhm.
Um, so foreign aid, at this point is still needed to address the emergency, and there is a lot more work to be done, to strengthen, including by working with those countries, not throwing money at them.
Well, Michelle, as you know, I'm really interested in the consequences of shutting down an agency I've long considered important, and I worked in Uganda too, so I have big interest in this, and I will be checking back in with you as we continue to see these problems that arise from just ending foreign aid in the way we did.